Please ensure that you're part of the MS Teams. I know initially last week some people didn't get the information because I'm assuming that the coordinators didn't reach out on time. So hopefully everybody was able to get it yesterday or whenever it was sent out. So you can be part of the MS Teams because that's how Yanessa communicate with everyone, just to make sure keeping you on track, reminding you of deadlines, and just to ensure that you're ready for fall semester. Okay. So we're going to talk about the CPAS process, stage one, which is the preparation, and then we'll have some question and answers. Stop me at any time. As I said, open your mic and speak, because the chat, I can't go back and forth with the chat. Okay. Stage two, we're going to talk about involvement, the requirements, the non-medical components of it, the medical components of it, and stage three is a completion, right? So we'll talk about question and answers at the end. So just make sure, because it seems really a lot of information, um, and a lot of information to share, and the process seemed very intense. But the reason why Ines and I were trying to keep track is we're finding that when students are ready for clinical, they're like, oh, I didn't get my VSS. So as a result, you can't get to clinical, right? So if you don't have the requirements, there's no clinical for you. And, frustration, a lot of frustrations from students. And, sometimes you feel maybe they didn't get the support in order to support them. So they have all the requirements ready for clinical. Right. So again, Dennis and I, we're here to support you as much as possible. Some people don't like the big groups. It's fine. You can always reach out to us. We can book appointments. We can meet before you submit your documents by the deadline. We can also meet with you just to make sure you have everything. So, we're here to support you as much as possible, but you have to let us know what support you need. Okay. All right. So the purpose, of course, of attending this preparedness orientation is to ensure that you're ready, right? You're entering a clinical environment adequately prepared to meet institutional, legal, and educational standards. So you've done your theory courses, or you're doing your theory courses. Now you're getting into the clinical setting, which is totally different, right? You're going into another environment, different from Seneca. Seneca has nothing to do with this environment. So you have to make sure you have the requirements in order to, of course, get to that facility, whether it's a nursing home or it's a hospital. Okay. We want to ensure that students are ready for clinical practice, equip students with the necessary knowledge and preparation to meet institutional and regulatory requirements, ensure that compliance with placement agency and it's completed and verified necessary documentation, such as immunization records, background checks, and certifications. For the most current information, you're going to refer to this link. So you can check out that link. You can take a copy, take a picture of it, and just make sure you have that link readily available to check information that if you need anything. You must regularly check your Seneca email and Microsoft Teams for updates. Failure to do so may affect your clinical practice eligibility, because if you don't have the requirements, you can't get to clinical. Missing deadlines will create ripple effect, resulting in ineligibility to join the clinical practice and potentially causing delays in your academic progress and career goals. People have timelines, they have families. So you want to make sure, you're prepared, you're ready. So you're setting your goals and your deadlines to say, this is what I need to do because I need to complete my course within a certain time, my program within a certain time. So you're going to set deadlines. So that's why we're here to support you, for you to set those deadlines and achieve those goals. So of course, there are costs associated with completing your clinical requirements. So everything is money, everything, right? So you have to pay for it. We're trying to prevent the paying twice. Okay, so deadline. So make sure you have this deadline at the tip of your fingers there. Okay, so we're going into fall 2025. So the deadline to complete all your and update all your requirements is going to be July 29th. July 29th, not July 31st. July 31st is for Yanessa and I to clear you. Look at what you submitted to Concise Health and we'll look at your documents, what you've submitted, and we'll make to ensure that you're cleared before you get into clinical. So July 29th is the last day to submit all your documents to Concise Health. So clinical term, of course, that's where you're engaged in clinical practice from September to December. You go to clinical once a week, okay? 12-hour shift. I'm not going to go into that details. I'm just going to try and focus on the clinical requirements. So the last day appointment again is July 29th for the fall. So all students must obtain clearance from Concise Health before this date. Okay. Any questions so far? All right. CPAS, or Clinical Permit Accelerator Screening System. So this is what we call the CPAS. It's a thorough screening process designed to help students meet and maintain the certification and immunization standard required by practice guidelines and legislative mandates. It follows a strategic timeline, as I mentioned, ensuring documentation is verified, validated, and monitored prior to students entering clinical practice. So there are three stages what we're going to talk about, which is the preparation, the involvement, and the completion. Okay. So stage one, we're going to look at the preparation, and it includes 3 steps. So stage one, follow steps 1, 2, and 3 in the steps to success. So clinical preparedness session, this is where you are today. Step 2, you're going to download your initial documents and applications. So in the CPP handbook, there's a link where you can find your consent package. There are 4 forms there. You're going to complete those 4 forms, and you're going to email it to Noreen Champagne by specified deadline, right? And the deadline to do that is May 15th. So email Noreen and get those 4 forms completed and send it to Noreen. Any questions on that? The 4 forms, they're in the CPP handbook.
So where can I get the CPP handbook?
So Yanessa was supposed to post it on the Microsoft Teams.
So it will be posted here?
Yeah, not here. And who is that? Is that Brianna speaking?
I'm Arya.
All right, so you don't have the handbook. You didn't get that?
No.
Okay. Anybody else didn't get a handbook?
No, you didn't get it.
Are you guys part of the MS Teams?
I don't think I'm a part of that.
Also not word.
Okay.
I didn't get it too.
Okay, so
I didn't get it too.
I didn't
So
get
you-
it either.
so you didn't get.
I want to just say something. So I thought that link to the MS Teams was for today's meeting, but on the bottom of the email that she sent, where it's join here, that is the Microsoft Teams link, because that's where I was thinking the meeting is there, and then it's over here.
Okay. So
Yeah.
you're talking about today. So nothing from her about the handbook?
It's at the bottom of that email where it says join here, Microsoft Teams, with all of that documentation.
Okay, so the handbook is there. Okay. Did you hear what who was speaking? I'm not sure. Did you hear what she just said?
Yes.
Yeah, we'll check. Yeah, we'll
Yeah,
check that after.
So at the bottom
yeah.
of the link, it's the handbook. Okay. Thank you.
Sorry.
I
Polly,
also put it in the
but
chat.
how do you get that? Sorry, you go
You
ahead.
put it in the chat? Okay, somebody put it in the chat. Good.
Hi, Annette. I've been able to scan it.
You're unable to scan
I'm able to scan my manual. I was able to scan, yeah.
for the handbook?
No, scanning for the registration for the
That's
meeting.
Emmanuel. So you're good now,
Yes.
Emmanuel. Okay, so I
Yeah.
can take you off. Okay.
Okay.
As
All right.
well as Robert Zuka. I've been able to scan as well.
So what happened?
I just navigated through the options.
Okay,
after
okay,
my
okay.
picture. Yeah, I was able to find it.
I used a different tablet to scan.
Okay, so you were able to do
Yeah.
it. Okay.
Yeah.
All right. So yes, somebody posted the link for the handbook, so thank you for that. So yes. So that's the handbook. Get the 4 forms from there, email it to Noreen, and make sure you do that by May 15th. Okay. Okay. So in that handbook, when you get a chance to look at it, and I would suggest, when I'm finished with you, if you're not at work or, not busy, go through the handbook because it seems like it's a lot of information, but everything that you need is in that handbook. Okay. So the clinical preparedness permit form. So that's in the handbook. And that's the form you're going to take to the family doctor or the walk-in clinic if you don't have a family doctor, or you can go to Seneca. There's a clinic at Newnham campus where you can go there as well. Get all your vaccinations and all the requirements that you need for the medical reasons. Okay. So it's to be completed by you and your healthcare provider. It's also required by Concise Health for your clearance review. So that form is crucial because that's the form you're going to complete, but the family doctor is going to complete, you're going to complete your section, and the family doctor is going to complete their section, and you're going to submit it to Concise Health. Kenisha, you have a question.
Yes. How long do the vaccines last? Because I've done vaccinations like in 2020. I know some last 10 years, like tetanus and stuff like that. But how long do they last? Like, is it just
So it just depends, right? So blood work is going to be required. So if you had, for example, tetanus is 10 years, there's no blood work for that. So the family doctor, as long as you have the evidence,
okay?
the family doctor will have that. You're going to we'll go into what you'll need. Okay. Yes, we'll go
Thank
into that. Yes. All right. So yeah.
I have a question.
Mhm.
For like the vaccines that we need to get and stuff, I just want to know about the COVID vaccine shot. Like, when do we have to get it, and how many do we need to get it?
Okay. When I get to the vaccine, Carola, you can ask that question again?
Okay, yeah, for sure.
Yes.
Okay,
Okay.
thank you.
Hello.
Because I'm going to go into details with the vaccines. Okay.
Okay, thank you so much.
All right.
So I also
Go ahead.
so I also have a question that what if we don't have a family doctor?
Okay. We'll talk about that. Easy.
Okay.
That's an easy one.
Hello?
No, if you have no family doctor, let me just answer that one. If you have no family doctor, you can go to a walk-in clinic. If you
Okay.
live close to Newnham campus, there's also a clinic you can go there.
Hi, sorry, I also have a question. I have my previous clinical requirements in terms of the vaccination from last year. Am I allowed to use that one again?
We'll have to see what's there. You have to get a new form, right? Your doctor has to complete a new form, but more than likely, whatever the requirements that you successfully had there can use again for this one, but you have to get a new form.
Okay, thank you.
I
Okay.
have a question, if you don't mind.
Okay, go ahead.
So regarding the CPP form,
Mm-hmm.
is it okay to use both digital and paper-wise for the Concise Health
You need paper.
appointment?
You need paper.
We need paper. And
Yeah.
also another question
So
that I have.
paper, hold on. Carola, is that you speaking?
Yes, go ahead, sorry.
So paper to take to the family doctor. Once it's completed, you're going to PDF it and upload it to Concise Health.
Okay, I see. And I have another question regarding the CPP form. I know our healthcare providers uses them to put in the dates of the vaccines and the stamps.
Mhm.
Do we also require any other proof of vaccination besides that? Let's say receipt, as it says in our handbook, or something like that?
Yes, you need proof for everything.
So besides what it says in the CPP form?
Yes.
Okay, thank you so much.
Okay.
I'm sorry. Hello.
Mm-hmm.
For the clinical permit form, I was told that it's in the email you sent us, but I don't happen to have the attachment on my email.
Somebody said it's at the bottom of the link that was sent. And the person posted.
No, it's not an attachment. It's just a link.
Yeah, it's not an
It's a
attachment.
link.
It's in the chat. Just click it in the chat.
Just click in the chat. It's in the chat. Somebody posted in the chat.
Okay, can the person try sending it again? Because I just joined the meeting, so I don't see it.
Oh, you're just joined. Who's speaking? Jeremiah?
Yes.
Okay, Jeremiah, you need to, if you just joined the meeting also, you need to go back and scan. Okay? This one? scan.
Okay.
That's the attendance. If you're on your phone, you're going to have some problems, apparently.
Okay, thank you.
Can somebody post the link again for Jeremiah, please?
It's been posted.
Okay, thank you. As I said, it's hard for me to go back and forth from here to the chat. Okay.
So what do I do since I'm on my phone?
Oh,
I mean, for the attendance sheet.
What do you do?
Yeah. I mean, for the attendance sheet.
Okay, so you're on your phone, so you can't get it? You can't scan?
No, I can't.
Okay. So you might have to, apparently there's some navigation there, but if that's the case.
Miss, good morning. So I sent the link of the form on the group chat. Just so if people cannot scan the QR code on their phone, the link is there.
Okay.
And
So do that, Jeremiah. You heard that?
All right, sweet.
For the attendance?
Yes.
Oh, okay. Hold on. Let me...
So you couldn't scan for the attendance. So she's I think Cindy was saying she sent the link.
Okay. I see the link. I'm logging in now. Thank you.
Okay. So it's great when you work together. Okay, thank you so much. All right. So deadlines, we talk about that. All right. Where am I here? We did the forms. Make sure you have the 4 forms. I think, Jeremiah, you logged on late. Have the 4 forms for the, from the CPP handbook. Email completed and email that to Noreen. Okay? She gets those 4 forms. So we talk about the permit, the clinical preparedness permit form, which is in the handbook. That's what you're going to take to the family doctor. And that's where the doctor and yourself is going to complete, because you might have vaccines if you're not, for example, if you weren't born in this country, you might have vaccines from back home, right? So you're going to make sure you bring whatever evidence you have from back home and just bring it to your family doctor so they can complete the form. Okay, Carola, go ahead.
So regarding the deadlines that we have in our CPAS, because I noticed there are certain dates, for example, May 31st or whatever. So about those deadlines, is it just a guidance on how to proceed with each step, or do we need to religiously follow it and submit some of the documentation by that date?
Good question. It's more a guidance, right? But most of it is more guidance, right? Because you're not submitting the documents to us. We are just giving you some timelines where you can keep up. The VSS, right?
I see. Yes.
Yes, you have to speak. Toronto students, please, 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 you're going to be so upset. Please, 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 and I'm getting chills when I'm begging you. Please submit as soon as possible. It takes us 8, and I say us because I live in Toronto, 8 to 10 weeks for a VSS. While in other regions, they can get it within a week, within 2 weeks. And last semester was a lot of frustration. So please, 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 if you live in Toronto, start the process now.
Sorry, can I interject about that?
Yes.
They are currently doing the end of March as of yesterday. So yeah, I agree with Yvette. You just need to submit that.
Please. You're going to be so frustrated. So I get chills when I say it, because I could sense the frustration last semester from students who wasn't able to go to clinical because they didn't apply on time. So please.
Sorry, Annette. I did one last year, same period this time, and that wants to be valid because I was to do clinical last fall, but I couldn't do, but I've done all those things. Can I still use a vulnerable sector check?
So you're in the BSN. I'm assuming I have all BSN students.
BSN, yeah.
For the BSN students, it's valid for a year. So if if you did it last year this time, which is April, right?
Yes.
So last year this time, so
I did it around July because it didn't come out on time. That's why I didn't submit it. It came out around July.
So it's going to expire in July, basically.
Yes.
You need a new VSS.
Okay. Thank
You'll
you.
need a new one for September,
Okay.
right?
Thank you.
'Cause
Yeah.
it
Thank
should,
you.
you have to think that none of your documents, right, or requirements should not expire during clinical. Right?
Okay.
So if your BLS, if your BLS is going to expire in October, you need to do it before September, because clinical starts in September. Right? So again, I'll
Yeah.
stress that once I get there. Okay?
Okay. Thank you.
All right. So the document, the CPAS handbook, it provides guidelines, right? Again, some of the dates there is just not rigid, and it's just to give you a guideline as to by this date you should apply. But as I said, the VSS, if you live in Toronto, please do so as soon as possible. All right. So your consent package, that should be submitted to Noreen by May 15th. So get to your finish today, complete it if you haven't completed it, and send it to Noreen. Okay, when you're doing that, so that's, of course, that's Noreen's email. When you're doing that, you should include your full name, your student ID, the program section, whether you're at King or Newnham, right? And it just gives you an example there at the bottom.
So this is just a sign, we just have to sign the document, right?
Yes, and put all that information at the bottom here. Area,
Oh,
your
we don't
student
need any other
number.
thing.
Yeah. So,
Okay.
Sorry, Miss. I just and the document links they're in the CP handbook, right?
Yes. Yes.
All right.
Yes.
Okay. Thank you.
Okay. Any other question? Good so far? All right. Step 2, 4, 5, 6, and 7. This becomes a little bit more complex. Okay. So your standard first aid. And please, please, please listen to this section carefully. Your standard first aid, if you have a standard first aid, it's valid for 3 years. Your BLS or your CPR with healthcare provider is valid for 1 year. The standard first aid, 3 years. So you might do the combine and thinking it's valid for 3 years. It's only valid for 1 year. The BLS or CPR for healthcare providers, only for 1 year. Okay, that's where students sometimes get confused. All right. When you're doing the course, you have to look for standard first aid with CPR for healthcare providers. If it's a standard first aid with CPR level C, that's not acceptable. The level C part of it, the CPR level C, it's not for healthcare providers. So unfortunately, then you'd have to go find a BLS course to complete, right? So it could be BLS or CPR for healthcare providers. So when you're choosing to do that course, please, right, look to make sure. Sometimes it's difficult to find a standard first aid with the BLS or with CPR for healthcare providers. So some students have to do it twice. They do the SFA with CPR level C, and then they do the BLS separate, right? So just be mindful of that, okay? And when you're registering for these courses, just make sure it's a legitimate organization, because there's some scammers out there, right? We had a student last semester, she was scammed. It's some fake people. So just be mindful and be careful of that, because everybody's looking for money, right? So, and you don't know who is legitimate from who's not. So you want to make sure you're looking at the legitimate websites when you try to register for that. Heaven Can Wait, usually, they usually do a session every semester. I'm not sure if the date and time is out as yet. I know they usually do the standard first aid, CPR for healthcare providers, and the mass fit. So you get 3 in 1, right? Which I think it's a good deal. So if that's something you're interested in, Yanessa will also post the date and time, and it's usually done at Newnham campus on a Saturday.
So I just got my mass fit done at work.
That's fine.
So that's fine.
Yep.
The company name says the place where I work here, so that's okay.
The company says the place where you work?
That's right. That's the
That's
company
fine.
name.
That's fine.
Okay, cool.
Yeah, that's fine. If you did it at work, guys, it's fine.
Because
Right?
the little paper doesn't it doesn't look like really special. So she's
That's
saying
fine. That's okay.
Then sorry to ask, if I did a mass fix last year to same period, can that be still useful? The mass fix?
If you did it last year?
Last year, September, same period, I did
Yeah, it's good
the
for two. It's
BLS.
valid for 2 years.
Okay.
The mass
Thank
fix
you.
is valid for 2 years. So if you did it last year, yeah, you're good.
I have a
Thank you.
question for the CPR. I booked it with Seneca King Campus. Is that the same thing you were talking about, or were you talking about something else with the mass fit and everything included?
That's a different one, Christine, but that's Seneca is fine. That's a different one.
Okay.
This one is a third party. The company's Heaven Can Wait, but Seneca, if you booked with Seneca, that's fine. But just make sure it says standard first aid for healthcare providers, standard first aid with BLS, or standard first aid CPR for healthcare providers.
Okay. Thank you so much.
Okay. If not, you got to pay again to do the BLS or separate, right?
I think I have to call them and see
find
what
out.
they're talking about. Yeah,
Yes.
because I think they did mine with the standard C. I'm not sure. I still have to call them. I'll call them on Monday.
Yes. Okay.
Yvette, I have a question.
Mm-hmm.
So for my standard first aid, I did it with a security company, and I just wanted to know if that would be accepted, since it has everything that you're talking about, like standard first aid with level CPRC, and I did my BLS with a different organization. I just want to make sure if such documentation, if I do provide it, like if it will be accepted.
It should be fine, Jeremiah. Your standard first aid is valid for 3 years. So I'm not sure how long ago you did it, but it's valid for 3 years. And the BLS, it seems as if you did the BLS separately because the level C is not accepted for healthcare providers, right?
Okay.
So for the BLS, it's done annually. So just make sure if you did it last year, it doesn't expire. It's not going to expire during clinical, which starts in September.
Okay. Okay, no problem.
If it's going to expire, then you have to, of course,
No, I did the BLS, but like I also did the level standard first aid level standard
C.
first aid, yeah, with the level C, but I also did the BLS, so I don't know if that would if that would still be accepted.
That's acceptable because you separated, right? Standard first aid with CPR level C. The SFA, the standard first aid is acceptable. It's just level C is not, the CPR level C is not acceptable, but you did the BLS.
Okay.
Right? Yeah. But just look at expiry date for your SFA because it's valid for 3 years, and your BLS should be done annually.
Okay.
Okay.
No problem. Okay.
All right. Any other question? Okay,
Yeah.
go ahead.
So where do we do these courses? Like
You mean the standard first aid and stuff like that?
Yeah.
Okay, so there are different organizations out there. Again, as I said, Heaven Can Wait is gonna come in. They do a session every semester on a Saturday at Newnham, or you can go to, there's a lot of reputable organizations there. So it depends on where you live, but just make sure you're going to those reputable organizations to complete it.
So Seneca does offer this?
Yes, yes. I think Christine said she's looking into a course through Seneca. Yeah, Seneca does offer it.
So is it offered in King or Newnham?
I'm not sure.
There's, if you go on like the Seneca website, it will send you a link, and you can, sorry, give me a second. So the Seneca website has a link where you could just press on it, and it'll give you a date, like it's like a week time period, that the link will be open, and then you register from there.
Can you share the website and the link in the chat?
I'm just driving right now. When I get to my house, I will send it.
Okay, thank you, Christine.
Okay.
And just remember when you're Googling and looking for these courses, it has to be in person. So some of the organizations, they'll do the BLS, for example, they'll do the theory piece of it virtually, but you have to do the hands-on in person, right? We can't do CPR online, right? That's not how we do things as nurses. So it has to be hands-on piece of it, not just the virtual. If it's all virtual, then that's not the course you need to complete. Find another course.
And I want to know when this certificate is needed.
When which certificate is needed? The CPR and standard first aid?
Yeah, I want to know when this certificate is needed for, I mean, the deadline for upload the certificate
For
to
your
you.
so you need it for your clinical. If you're going in September, you need it for your clinical. Now, the deadline to submit your documents is going to be July 29. So you have to make sure if you need to do both courses, standard first aid and BLS or CPR for healthcare providers, you have to make sure you complete that before July 29th. Don't wait last minute, because when you complete these courses, this certificate sometimes takes a week or two before you get it. And that's why we are suggesting do not wait last minute.
Oh, okay, thank you.
Okay. So you'll get a temporary certificate. Puya, I'm not sure if that's how you pronounce your name. You'll get a temporary certificate. And then what happens if the deadline comes July 29, you upload the temporary certificate. Concise Health, which is the third party that clears you for clinical, they might say this is a temporary certificate. So then you have to pay again to upload the original certificate once you receive that. So that's why we're saying do these things early, right? And just make sure you have everything so you don't have to pay twice.
Okay, for sure. So the second question, BLS or CPR level C is needed, is required to upload, not both of them, right?
Yes, so BLS, standard first aid, and CPR for healthcare providers or BLS.
Okay, thank you.
All right.
Sorry, could you say that again? You need two. You need first aid and BLS, the two combined.
You need standard first aid. Okay.
Yeah.
So some of this is where it gets confusing, right? Because some of the places, some of the organizations, they do standard first aid and BLS level C. BLS level, CPR level C. CPR level C is not for healthcare providers. So if you, for example, did this course last year and it was standard first aid with CPR level C, you now have to go do the BLS, because what you have is part accepted, but acceptable, and the other part is not. It has to be CPR for healthcare providers or BLS. Make sense?
Yeah, it does. Thank you.
Okay. Everybody clear on that one?
Sorry, I have a favor to ask. Is it okay if, for those of us who probably need clarity, is it okay to forward what we have? And maybe you can check and confirm
Okay,
if
so love it.
it's
What do
okay.
you have? What do you have?
Okay, so currently I have, I took the CPR/AED level C.
That's
first
not
aid.
the CPR level C is not acceptable. So you will have to do BLS.
Yeah, okay. Okay, okay.
Okay.
So if I'm able to do the BLS, then I can, then this first aid and CPR/AED level C can be accepted.
The SFA part of it, the standard first aid part of it will be accepted, right? But then you have to do the BLS separately, and then you can upload those documents.
Hi,
Make sense,
so-
Lavelle?
I want to say makes sense, but maybe I'll feel better if maybe I can share my
So,
document.
okay. You have the standard first aid with AED level C, right?
Yes, with Red Cross.
Right. The AED level C is not acceptable.
Okay.
Right? So the first part is, which is the standard first aid, the AED level C is not acceptable. So now you have to find a BLS course.
Okay.
Right? Or it's either BLS, they name it, or CPR for healthcare providers.
Okay.
Right? So that's the course you need to find.
So sorry if I may ask.
okay.
So sorry if I may ask. So the BLS and the CPR first for healthcare provider are they the same thing?
The same thing.
Oh,
BLS
nice one.
and
Okay.
CPR for
Thank you.
healthcare providers, the
Yeah.
same thing.
Okay.
I can
Thank
just
you.
go
Sorry,
ahead and do
please,
the
I just
BLS
want to
then without doing the
confirm.
CPR.
Oh my, I've been
That's
trying
okay.
to.
That's okay. That's okay. All right. It's a big group, so we know there are going to be a lot of questions. That's okay. Go ahead.
Sorry, please, I just want to confirm something. I hope I'm not interrupting. Sorry, but I did the Heaven Can Wait
Okay.
standard first aid with the
Okay.
BLS.
That's fine.
Okay.
That's
Okay.
perfect.
Okay. Thank you.
Hey, I do have one question as well.
Okay, go ahead.
Yeah, so my certification says like standard first aid with CPR, BLS/HCP and AED. And they got an expiry date for in 2027 because I completed last year. Is that good?
So we're speaking, Ravneet.
Yeah.
Send me a copy of that because it seems as if you have standard first aid, right?
Mm-hmm. Yeah,
Sta-
standard first aid with
Uh-huh.
CPR, BLS
Okay.
/ HCP and AED.
Okay, so I'm not sure how you have so many things on that certificate, but the SFA, which is a standard first aid, is valid for 3 years, and the BLS should be valid for a year. So send me a copy of that. Let me look at it.
Okay.
Okay.
To your email address?
Yes, you can send it to my email.
Okay, sounds good.
Okay.
Thank you.
Then I look at it and let you know.
Perfect. Thank you.
Okay. All right. We good on the standard first aid BLS. Okay.
Yeah, I have a school here saying like the name of the school is called CLI College. It's saying standard first aid with CPR training, AED, and BLS. Is that going to be acceptable?
That's fine.
Cool.
Because they have the BLS part of it. That's fine.
All right then.
Okay, and Ravneet, the reason why I'm asking you to send me yours is because you're saying it's going to expire next year, right? Because
I
the standard
yeah,
first aid should be valid for 3 years, while the BLS is expire. You have to do it annually. So send me a copy so I can have a look.
sure. Yeah, because I completed last year in October and it says the expiry date in 2027, October 6th. Sure, I can send you a copy on your
It is
email.
last year, so 2024, 25, 26, 20. Okay, yes, so that's fine. Because they're going off the standard first aid, that's going to expire in 3 years, but the BLS expires next year, this year, right? Because you did it 2023,
Yeah, right. But it
2024.
altogether says the expiry date for that. I'm not sure about that.
No,
That's why I asked.
no, yes, you have to do the BLS.
Okay, thank you.
Okay.
Hi. I just wanted to reconfirm with you again. So this is Lovett speaking again.
Mhm.
So in conclusion, the standard first aid part is fine. I just need to do another BL. I need to do a separate BLS. That's what you're
Yes,
saying.
yes, and you can send me the document, love it, so I can just look at it.
Okay.
Okay.
Okay. Thank you so
All
much.
right.
Yeah.
Okay. So the next one is the WMIS. So seems as if I have all BSN students here. So your WMIS, in the handbook, there's a link. So if you go through your handbook, you'll find the link for WMIS and you'll complete that. So for the BSN students, you have to do that every 2 years. For the PND student, it does not expire. Okay, so find the link, copy and paste it into a new browser and complete the module. Please do not wait last minute because sometimes, students just wait last minute and the site just crashes. So get that done as soon as possible, right? And so that's out of the way.
Sorry, where can I find the link?
It's also in the handbook.
Okay.
I just want to ask, how do we get to save this certificate? Because once it comes up, you just can't print, you can save nothing.
You should be able to save it or take a picture if you can't.
Okay, a picture.
Yes.
Okay,
Because we need PDF, right? So because Concise Health needs PDF documents when you're uploading.
Okay.
Okay. All right, so that's the WMIS. The Ministry of Labor, Worker Health and Safety Awareness, also a link. BSN students, every 2 years, you need to complete that. Copy and paste the link into a new browser and save the certificate because you need to upload that to Concise Health. All right. Okay, so those are the easy ones.
Sorry, excuse me. The WMIS we did last year for the same period, can it be useful? The certificate can it be useful?
Yeah, because it's
again.
valid. It's valid for 2 years.
Okay, thank you.
Okay. The VSS. So this is the nightmare. Okay. So again, as I said, if you live in Toronto, start, right? Peel, York region, they're faster, right? But they were kind of backed up last semester as well. But please, Toronto students, you're waiting 8 to 10 weeks. Please, for you to get the VSS, you need to email Noreen, right? And the email address is there. Send her a copy of your one card and also your postal code. She'll send you the code because Toronto students, you need a code. Some regions need a letter. So you send everything wherever you live, send it to Noreen with the postal code, and she'll send you all the information that you need to apply for the VSS. Now, for the I can't speak for the other regions, but I know for the Toronto students, sometimes they send you a link for authentication. You know, everything is authentication now. I'm not sure if it's everybody gets it, but maybe I'm not sure why, maybe some students get it and some don't, but please check your email, because what happens, they send you information to authenticate, you don't check it, you don't check your email, and then 2-3 weeks after you realize, oh my gosh, I didn't authenticate it. And the minute you authenticate that, that's the date that it's going to state on it that you applied. So if you do it, for example, today and you submit it, and they send you a link to authenticate 2 or 3 days after, and you don't, and you, of course, it's been sitting in your email because you haven't authenticated the information, you're not, again, that's a delay in the process. So you have to make sure you're checking your email quite frequently.
I just have a question. So if I live in Toronto, you're telling me I can't do it without emailing this person first to get a code?
Yes.
So how long does she take to answer that email?
She's fast, don't worry.
Okay.
It took her within 24 to 48 hours to get. She's quite quick.
Yes. And remember, she's dealing with a lot of students, but yes.
I have a question. I actually did it yesterday, and every time I try to go through it, the authentication error happens like 5 times, and I have like multiple times only to like attempts to get this authentication errors. So I don't know what to do. I didn't receive any email, but I paid. I did everything. So what do you recommend I can do for that?
I'm not sure what happens.
Check your junk mail. It may be there.
Yeah.
No, it's just like I completed everything and paid, and the authentication is like about the credit something. It never shows up to me. It just every time I try to continue to authentication, it brings me like errors. So I try to email them.
Try calling them.
They don't answer. I try to email them. They send like an automated message.
Do you live close by?
I'm not sure. So should I give them, like, should I visit or go to them?
Yeah, you can visit. You can go there.
If you call the non-emergency line, because I'm from Peel region and this worked for me. If you call the non-emergency line, they'll be able to direct you to the right people. Like they'll like transfer the call, and then you'll be able to speak to somebody.
Or Christine, Toronto, they don't answer.
Yeah,
they okay.
They don't answer.
Did you call 311, the Toronto line? They could probably route you to the best person.
I don't know, Yara. I would suggest you go straight there.
Right, because
if you have time, don't wait.
They said like if I miss this at like attempts number, if I pass them, I have to create another one. Like
go straight
there.
Did
everything, right?
Yeah, we have a day off this next week.
Yeah, I can go today, but I don't know if they're.
I don't think they're open today. No.
Go,
I would suggest you go straight there.
Miss.
Yeah, thank you.
Miss. Sorry, so I live in Peel. Do we have to also like email Noreen and for the VSS?
Yes.
Okay.
Because I think Peel, somebody needs a letter. One of them also needs a letter. You can try. I'm not sure who needs a letter. Somebody needs a letter, but you can try, but it will tell you what it needs, what the requirements are.
Okay.
Yeah.
Thank you.
Corolla, go ahead.
So I actually did this VSS screening last year in November, and I didn't have to send any email. I don't know.
I don't know how you were so lucky. Where do you live?
Peel region.
So maybe Peel doesn't, but try it. I know the other day I see students saying there's somebody needed a letter, right? So it just depends on the region. So if you go ahead and try and it's saying that you need certain requirements, then you can reach out to Noreen.
Okay, so I did it in November. Do I have to do it again?
Yes, because
November.
it's a year, you're gonna expire during clinical, right? And you shouldn't expire nothing should expire during clinical,
Okay, thanks.
right? Because November to November and clinical starts September, so the VSS will expire in November.
Okay, thank you.
So you have to do it again. Yes.
I have a question.
Mhm.
I am in York region, and I actually applied for this on January through their website, and I got it. Is it okay, like without going through Noreen? They didn't ask any letter.
They didn't, that's fine. That's what I'm saying. Some of the regions maybe don't need it. So if you try and you didn't, that's fine.
Okay, thanks.
Any other question?
Yes, I actually have a question. So
Mhm.
we were talking about authentication of the VSS.
Mhm.
So I noticed, for example, in my case, it tells me in my email that there is a digital signature located inside my record check file in the PDF. Is that okay, or do we need some other sort of authentication for the VSS? Because mine, it says it's in a digital signature inside my PDF for the VSS.
I'm not sure.
So I received my VSS clearance.
Yeah. You got it
And
back from Toronto?
I'm not in Toronto, I'm in Simcoe region.
Okay. Mm-hmm.
And for the authentication part, which you mentioned earlier, I didn't get a certain link. I got it in a digital signature that it's located in my VSS.
Okay.
So is that okay? I just
That's
want to
okay.
confirm.
Yeah, that's okay. So can you see the VSS result?
Yes, I can.
Okay, as long as you can see it, because again, every region has a different process. But as long as you can see it and it, so send is it Carola? Send me a
Yes.
copy, Carola, just to confirm that you have the right thing.
Will do. Thank you.
Okay, all right. So that's the VSS. We're good? We're clear? Stress during the students. Don't wait. All right.
Durham only takes 2 weeks.
Yeah, that's what I heard. It's too many of us in Toronto.
Huh?
That's why.
No.
Too many of us. All right. So all students must have, of course, a negative clearance to attend clinical. And if you have a positive clearance, then of course that's going to be a meeting with the coordinators to decide what's next. What's the next process? Okay. So that's the VSS. If you're 17, there's no VSS. We can't do police check on 17-year-olds, so you'll get a waiver, right? So if that's the case, reach out to Noreen. Noreen will send you the waiver letter, so you don't have to do the VSS. N95, if you did it at work, that's acceptable. Just make sure you have the evidence. Everything that you're going to submit to Concise Health, you need evidence. So just make sure you have everything. You had the COVID vaccine, right? Public health. If you got it in another country, make sure you have something because, they need to see evidence. So for your N95, it's valid for 2 years. And if you need a test done, just make sure, again, you can find locations near you, reputable organizations, again, because there's a lot of scamming, right? That's not for you. All right. Any questions? Any questions? Any
Hey.
questions here?
Hello. Yeah, this is Sean. I want to ask a quick question. We did vaccination and the third dose stuff, but the email message then, some of them are it's like missing. So we only get if I check my email, I only get one or so. So is that how we can get all our records for vaccination from the Ministry of Health?
Okay, can you repeat the question, please?
Some of the emails are kind of missing from the vaccine we did
for the COVID?
19. Yes.
Okay.
So I don't know if is that it means we can get like the full vaccination document.
Yes.
Okay.
Yeah, you have to reach out to them.
So it's a minimum of 2 doses or 3?
If you got 3, that's fine. That's good because some places prefer 3. If you got 2, that's fine too.
Cool.
Okay.
Sorry, please, I have a question.
Mm-hmm.
You said we have to do the VSS again, check again.
Mm-hmm. When was the last
For
time?
me, I did mine in November last year, right?
Yeah, so you have to do it
Do I
again.
have to do it now or like wait? I don't know. I'm just
Where do you
wondering.
live? Akuda, where do you live?
Peel region.
So Peel takes 2 weeks, it seems as if, so you're kind of faster. So you can hold off a bit, but just make sure you need it before July 29th to submit.
Oh,
You
okay.
cannot use it
Okay,
going
so
into
I cannot submit the one I did last
no,
year.
no,
Oh, that's the
because
point I want.
yes,
Okay,
because it's
okay,
going to expire during clinical, and none of the doc requirements should expire during clinical,
okay,
right? So
okay,
November it's going to expire, which means you will be in clinical when it's expired. So you can't do that.
okay. Thank you. Thank
Okay,
you.
so if you
All
live
right.
in Peel, you live in York, and you want to wait, right, closer, but please don't wait too late because now it's May. The Toronto students can go ahead and start now. But if you June, right, if you think it's 2 weeks, or to remember, sometimes Peel and York they're backed up too. So you want to give it enough time so you can get your results back before the 29th, right?
Okay, thank you.
Okay.
I have a question.
Mm-hmm.
What if for the BSN, like we have another clinical like in the winter, that's after the coming fall, we have an extended clinical in the winter.
Okay.
And what if like should we ensure that the documents are extending past that time, or it has to be valid until December of this year?
So it can
first clinical.
It can extend until next fall winter as well, love it. It just depends on when you did all the requirements, the dates, right? So once you submit your requirements to Concise Health, they'll determine if you're going to be cleared for the fall and winter. Because some students, sometimes they're cleared for 2 semesters, just depends on, of course, the requirements and the date that they completed it, right? So for example, your BLS, if your BLS is going to expire next year, April, then you'll be able to be cleared for the entire year. It just depends on what's going to be expired.
To add on to Yvette's answer, you have to pay for the Concise Health. So if you don't want to pay twice, you might as well do it all at once for the year versus 2 semesters, because I believe it's $60 per visit.
Yes.
So if you want to, let's say if it's expiring in December or January, if you go to Concise Health for that timeline, that means you have to pay again for the winter semester. So you'll be doing $120 versus $60 for the whole year. So I would advise, as a fellow classmate, just to do it once to save money.
Okay, thank you.
Okay. Thank you, Charlene.
Sorry, I have a question. Where do we get this thing done?
What?
The Concise Health?
There's a link in the CPP handbook.
Okay.
So once you have everything, who's speaking? Is it Christine? Christine,
Yes.
once you have all your required documents, you upload that to Concise Health and you pay $60.
Okay.
That's why I'm saying try not to do it twice, because if you're missing a document, you have to pay like another $35. So you'll pay the $60 for, let's say you have everything, Christine, and you're waiting for the VSS, right? You upload those because you're like, oh my gosh, the VSS is not here yet, and I'm getting close to July 29th. Let me upload this. Once you get that VSS, you have to do a return clearance, and that's $35 again, right? So that's why I'm saying try and get everything done early, right?
Okay, perfect. Thank you so much.
Yes.
Hi. Hi, hello. Where do you find the form that the doctor signs when you
It's
get
in the CPP handbook, Chinese.
But I wasn't there when I looked. Like, there's nothing for like the doctor to like check mark saying like, oh, you.
It's there. It's a 10 of how many pages checklist. It's a CPP clinical permit checklist form is in the handbook.
Okay. Thank you.
You have to go through the handbook, right?
Okay.
And it's a link, and you just click on the link and you open it, and you'll see the CPP form.
Okay, thank you.
Okay.
I'm sorry, one more question about the mass fitting test.
Mhm.
Where can we get this done?
Karen, you gotta find locations near you. Heaven Can Wait. Apparently they're gonna be they've scheduled a session, and they'd also do mass fit, but they have to have 8 students, at least 8 students. So I'm not sure if they'll do it when you're doing the SFA and BLS. But you know you can Google and check organizations close to home, right?
Okay.
And yeah, and just make sure they're not scammers. But yeah, and you'll know because you know advertise and just look and see. And sometimes, you know, you get feedback and of course reviews. Just want to make sure you're going to reputable sites.
And we get a certificate after that?
Yes, you get your certificate.
I'm sorry that
Just a little card. You know, some people give you a little card. Yeah.
Yvette, I just have a question. In regards to you saying about the certifications, like you were talking about like a student got scammed. Like in what sense? And like how did that go on for that you knew that the student was scammed in some sense?
It's funny because it's a student. So the student did the standard first aid and BLS. I'm not sure how she knew. She found out, but I guess when her documents, when she was about to submit her documents very close to the deadline, she reached out to us and said, "Oh, this is my standard first aid and BLS. However, I found out that I was scammed." So I'm assuming she called. There maybe was a phone number. Maybe she wasn't getting the official certificate. She got like a temporary one, and now she needed the official, and she wasn't getting it. So wherever she called, and I guess maybe I'm not sure if she went back to Google. I'm not sure, but then she found out she was scammed.
Oh, okay.
Yeah. Yeah.
Okay.
Okay.
I have a question.
Yes.
Sorry, I have a question regarding the CPP form for the healthcare provider. There's a page that it's supposed to be completed by the healthcare provider. And it also says signature, stamp. I'm assuming that also has to be completed by my family doctor, right?
Yes. Yes.
Because when I took this form to him, I don't know for what reason, he said this is not for him.
It's for him.
Okay, and also it says a CNO/CPO number.
Yes, so he can put a stamp. Some people just put their stamp that includes the number, right? Or
Okay.
yes, or yeah. We prefer
Thank you
the
so
stamp
much.
because it has everything.
Thank you so much for confirming. Thank you.
Yes, because anybody can sign, right? So we want to make sure there's a number attached to it as well.
Agreed. Thank you.
Yes, yeah. Okay, so here is the complications, and it's a summer now, ladies and gentlemen, and doctors go on vacation. Doctors, nurse practitioners, they go on vacation. So if a doctor is gone for 3 weeks and you're waiting for them to complete the CPP form and your timeline is coming very, very close, you need to find alternative, right? So please, please, please start this process with your family doctor as soon as possible so you can get all the requirements that you need. If you need to get the vaccines, if you need to get a booster, because the blood work is going to be involved here, right? So there's a process that will take some time, right? So your tetanus, diphtheria, pertussis, and polio. Now, the assumption is everybody got a polio shot. No matter where in the world you were born, you got a polio shot. But do you have the evidence that you got it? Some people don't, some people do, right? Now you go to your family doctor because you're coming from another country like me, and I'm like, I don't have a copy of the polio shot, but I knew I got it. Some doctor will give a booster because you don't have the evidence. Some doctor will say everybody got a polio shot. No, we can't go against the doctor because they're saying they're not going to give a booster, right? Because they know everybody got it. So the assumption that at some point you got it, right? We have to accept that. Consent has to accept that. If you have the evidence that you got it, in Canada, there's a vaccine card. In other countries, I'm not sure what's given, but hopefully you have something to provide that you have at some point got gotten the polio shot. The tetanus, again, the same thing. If you can remember when was the last time you had it and you have the evidence, then of course the doctor will do whatever he or she needs to get to do, right? Because we want to make sure you're up to date. The tetanus is valid for 10 years. So if you can remember when you last had it and you need a booster now, then your doctor will provide that. Okay? And it's a combination. The part of the polio is separate. Okay.
I have a question about polio. I visited my doctor yesterday. I do have the record of the dose when I received like back home. I do have a document, but he wasn't sure if I need to do the full series, like full shot again, or just one dose of booster is enough. He wasn't sure.
So he wasn't sure if you need to do everything all over or just a booster?
Yes.
You don't need to do everything over. You just need a booster.
Like just one dose, right?
Yeah.
Because if you look at the guideline, it's pretty confusing.
Yeah.
So just one booster.
Yeah. Just for the Tdap, right?
No, polio.
For the polio. So you had it back home?
I had back home like when I was a kid. Tdap, I had it already. Just the polio.
And you have the evidence of the polio that you got it?
Yes.
Yeah.
3 doses.
It's usually one-time thing. So he doesn't have to do it again if you have the evidence. The doctors who need to do it again, it's the people who need to do it again is sometimes they have nothing.
Oh, okay.
Right?
Okay. Thank you.
Okay.
I'm sorry. My question is, so if you don't have any evidence for any of these shots, you
Yes.
have to do them again?
Your doctor will maybe have to give a booster, Lovette.
Okay.
Okay, because you need the evidence. We can't send you to clinical if you have nothing.
And do we submit the evidence of the original book? Like even though
Yes,
it's
just copy it. Yes, Karen, copy it, PDF it, and you upload it with your
even
document.
is not in English?
Can you get somebody to translate?
Okay. Might as well like should I get a booster? Like
Let your doctor decide, Karen.
okay, thanks.
Right? Yeah, because
Okay.
apparently there's a place you can go. I would have to speak to Yanessa about that. There's a place you can go to, of course, to translate it and put it in English.
You can ask the Toronto, what do you call it? The Ministry of Health. They have translators for immunizations. They do it for free.
They do it for free.
I just don't know where exactly to call, but yeah, that's how I found out from a doctor from a clinic is where they can
go and
translate it for
okay.
free. Yes.
Okay. So
Thank
Karen,
you.
look into that because if you don't need to take the booster, don't.
Okay, thank you.
All right.
Yes.
All right. So we're good with the Tdap and the polio. All right. MMR. So measles, mumps, rubella, varicella, and hepatitis B. Okay. So this is blood work, right? How do you know you're immune? Blood work. And some people are like, oh, well, I know I got measles so many years ago. So why do I need blood work? Yes, because we all got the vaccine at some point, but it doesn't mean that we're immune. And that's why the blood work is important, right? There are people who will get how many series of the measles vaccine and they're not immune, which means they're a non-responder. So the doctor will do the blood work. So that's why I said start the process early. The doctor does the blood work and we look to see what immunity you have, and then they'll do boosters if it's required. Okay? So, hepatitis B, okay. We do the blood work for MMR and varicella and hepatitis B. If you shows immunity, no further action required. No immunity, you need booster. And we'll go a little bit more into especially hepatitis B and the booster, and some doctors don't want to give it again because you're a non-responder. We'll go a bit more into that. But once you're immune, MMR and varicella is usually the easier one because most people, they have the immunity. Some people don't and will need a booster, but most people, based on what I've seen so far, they're fine. Okay, so that's why the blood work is so important for you to just make sure you get it done. If you have blood work within the last, since 2020, which is 5 years, that's acceptable. You can use that, okay? So you don't have to do another set of blood work if you have it, if it's within the last 5 years. If you have nothing within that, then you need blood work. Your hepatitis B. So again, with your hepatitis B, same thing, just as your MMR. If it shows immunity, you're good. No booster. So regardless of your vaccination history, students who will be entering their first clinical placement must do the test unless you have a recent blood work, and we call recent from 2020, and it reports that confirms your immunity within this year or the last year. If no immunity after a previous series of hepatitis B vaccine, then we'll need to not do another series, but you're able to go to clinical. And I'll go into specifics detail in regards to the hepatitis B, because that's the kind of complex one. It is your responsibility to keep your records updated by returning to Concise Health for review of your pending documents. So if, for example, you're not immune to hepatitis B and you need to get a series, and you uploaded your document and it shows that you're not immune, you need, of course, once you have that immunity or once you receive the vaccines, you have to do a return clearance to Concise Health and upload those documents. All right. So blood work confirm immunity for hepatitis B, you're good. No other requirements needed. If it shows no immunity, but you have 2 doses previously, or I have a record of 2 doses of hepatitis B vaccine when I was a child. Of course, some people, they got it when there was a child. Some people got it older. So if you have 2 records, if you have 2 vaccines, because in my days it was only 2, and if you have 2 vaccines and you do have the record, but the blood work shows no immunity, ask your healthcare provider to enter your record in the CPP form. So you're going to record that you had the 2, right? And start a series of 3 vaccines. So you need 3 because you got 2 or 3 previously with no immunity. After the first dose, because again, you have had this vaccine before, you're just not immune. After the first dose, you can go to clinical. If you've had 2 previously in the past or 3, but blood work shows no immunity, you can, of course, the doctor will have to do another set of series here, but after the first dose, you can go to clinical. Because it's first, you have the first dose, then the second dose is like 4 weeks after, and the third dose is about 6 months after, right? So after the first dose, those who have had 2 previous doses or 3 previous doses with no immunity, after the first dose, you can go to clinical. Okay. Shows no immunity and you have never had the vaccine, right? No record, you have never had it. Again, the doctor is going to start a series. After the second dose, you can go to clinical. But please, please, please ensure that you have to follow up and complete the series, which is the 3. Same thing as the first one here. Even though you can go to clinical after the first dose, you have to go back for the next 2 as well. Okay? Same thing after the no immunity, no previous record, you can go after the second dose. But again, you have to make sure you follow up and do the third dose. And
I
after
have a question.
complete the third dose, hold on there, Karen. After you complete the third, or Corolla, after you complete the third dose, then you have to also do lab work. Okay? All right, who had the question? Was it Corolla?
Yes.
Okay.
So I'm reading here that you need to do a post-vaccination lab test
Yes.
After the 3rd dose or 1 month after the 2nd dose.
Okay.
Is this to be also submitted with our Concise Health review?
What needs to be submitted?
The post-vaccination lab test after the
Yes.
2nd dose.
Yes.
So I will also need that because it says 1 month after the 2nd dose, which it's a lot of timeline.
Yes, it's a lot of timelines. So most doctors don't want to complete the blood work until after the third dose, unfortunately. Right?
That's
So
what I'm
if the
saying.
doctor says, I'm not touching it after, I'm not doing the blood work after the third dose corolla, that's still acceptable.
Okay, just wanted
But
to confirm because if it's needed for getting our clinical permit,
yeah,
it might not be in time for that.
no.
Okay, okay,
But
good.
they'll
Thank you.
clear you, so don't worry about that. They'll clear you, just have to make sure you go back and upload.
Okay, thank you.
Yeah. Any other question? I just have to pause for a minute here.
I just have one more question.
Hold on there. Okay, Jeremiah, go ahead. Sorry about that. Go ahead.
It's okay. I just wanted to clarify, just for the, I'm just reading the handbook just to be sure. Okay. So for the, just to make sure that the medical requirements, right, for the immunization, we need to make sure that we have our tetanus, polio, measles, varicella, and hepatitis. And so as long as we have all those vaccinations, then we're able to like go with our clinicals, just to be sure.
Yes.
Okay.
Yes. Now, going back to the hepatitis B, some doctors, of course, well, let's start off with students first. Some students will have the first series and no immunity. Blood work shows no immunity. The second series and blood work shows no immunity. The doctor is not going to do anymore. Right? So again, it depends on the doctor's practice. Everybody has their own practice, right? But what some doctors are saying, after, if you have had 3 and now you're coming back for another set of series, some doctors will only do 1, right? It just depends on what the doctor is in agreement to do. And again, no fault of your own. We just have to go with what the doctor is recommending, right? So if you can have the 3 vaccines years ago with no immunity, then you have another set of 3 and no immunity. You're a non-responder because we're not going to keep, the doctor is not going to keep going with the vaccines. Same thing with the measles. You maybe had it years ago and the doctor gives a booster, blood work still shows no immunity, you're a non-responder. So, you know, they're going to be, of course, it's not going to be black and white for everybody, but that's okay. We're human beings. We're all different, right? So we work with that, and Concise Health does work with that as well. So just so you're aware, it doesn't mean because you're of course, you're a non-responder, you can't go to clinical. It just means the doctor says you're a non-responder, no more vaccines for hepatitis B. Okay?
Okay.
So no need to panic if that happens.
Okay.
Because it happens to some students. Okay? All right. So we're good with those vaccines. TB. Another complex one. All right. I'm assuming I have all BSN students. So yeah, your TB is good for a year. You should have the first and second step done and have a record of that. So if you have had the 2-step done years ago, please make sure you have a record of evidence. You can, of course, share with the doctor. The doctor can put on the form, and that needs to be uploaded. Now, if you have had the TB test, some doctors, again, depends on their practice. They're going to do the 1-step. Let's say January, they did the first step, and 4 weeks after, 2 to 4 weeks after you do the second step. Can't remember. Yes, I think 2 to 4 weeks. They did the first step and you're positive. Some doctors will stop there. They won't do another one. Some doctors, you're positive for the first. Okay, let's do the second one and you're positive. Then yes, so you're positive. then of course, no more TB tests. If you're positive, you're positive. Don't even, the doctor is not going to repeat it. So moving forward with those, with students like those, it's going to be the chest X-ray. If you're negative, you do the TB test every year. So you do the TB test now and you're negative, it's going to be next year, this time again, you repeat the tests, right? So if you're negative, you do that annually. If you're positive, right, it's one shot, you're not doing it again, but you're going to do the chest X-ray every 2 years.
Okay, so sorry if I may ask, I did chest X-ray last year the same time, and the chest X-ray proved no trace of it found.
Okay, so Emmanuel, you have a cup. Okay, so you did the TB test last year?
Yeah, and the chest X-ray, yeah, last year, and I have the evidence.
And you have the evidence. So,
yes.
And you have, so what you need a copy of the X-ray.
I have it.
Okay, and you'll also need your doctor to write on your CPP form, no signs or symptoms of TB.
Okay, yeah.
What if you don't have the chest X-ray? But
We'll answer that. We'll answer that in a minute. So Emmanuel, remember, because students missed this last time and had to go back and pay, and other people got upset, and I knew we stressed that. Doctor, you have the chest X-ray because you're positive, so you had it last year. It's valid for 2 years. You also need on the CPP form where it has a TB section, the doctor can just write on the right-hand side, no signs or symptoms of TB.
Okay, thank you.
Right? And to prevent another payment. Okay?
Okay.
Trying to save you money here, right?
Yeah.
Those little nuances that you have to pay again, of course it's upsetting. So that's why I'm stressing, please, 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 make sure that's written. Okay.
I have a question, sorry.
Hold on, let me answer Adendral. I'm not pronouncing it
sorry.
right.
Yep.
Go ahead. Adendral?
I said, what if we don't have the evidence of the chest X-ray?
You don't have the evidence? Were you positive?
No, I wasn't. But the doctor, it was sent to the doctor directly, not to me. So she has it, and she documented it.
But so you were positive why you had to do the X-ray?
Oh yes, I'm African.
Yeah. So you need a copy. Ask the doctor for a copy.
Oh, okay.
Yeah, doctor has a copy.
Yes, she does.
Yes, so she has to upload, you have to upload that. So you need a copy and let the doctor write on that form, right? The CPP form, no signs or symptoms of TB.
All right.
Okay. Charlene, is it Charlene?
I'm just reading. Yes. I'm reading a slide. So I done the 2-step, let's say 2 years ago, and they were both negative. Do I need to do a 2-step again or just the 1-step?
Just the 1-step.
Okay.
The 2-step is just initial. So you did the 2-step last year?
2 years ago.
2 years ago?
Yes.
Yes. So you need a 1-step this year.
Okay, thanks.
So make sure you have that 1-step before clinical starts in September. Okay.
Sorry, I just have a question. So I did like the 2-step TB thing like 3-4 years ago. So would I have to do like a 1-step or
just a 1-step? You need Corolla.
Okay, thank you.
You just need the 1-step. Once you have previously done the 2-step, all you need is the 1-step, right? So you just make sure you have the evidence, a copy of something there to show that you did the 2-step. Okay. If you were negative Corolla, yes, you need the 1-step. If you're positive, it's the chest X-ray. Because once you're positive, you're always going to be positive.
I think that was Aaliyah. This is Carola. I have a question
sorry.
as well.
Yeah, go ahead. Go ahead.
I also have a question regarding the TB test. So I know it depends on every healthcare provider's approach, but my family doctor approached this in this way. He first administered my first step of TB testing. So I didn't do my vaccines yet. And I think we have to wait 28 days for the second step. Is that correct?
Yes.
And is it okay if we do our live vaccines, just in case we need some of them? Is it okay if we do it after the TB testing and not the other way around?
Oh, I think you had sent us the email about that, Corolla.
Yes.
Yes, because
I
some
just want
doctors
to
don't,
confirm because
yeah, they don't want to do
it's
the
a bit
live together.
confusing.
Yeah, because you're going to do, so you did the TB already.
Yes, the first step.
Okay, and you have to do the two-step?
Yes.
Yeah, because you've never done the two-step.
No.
Okay, so then, so you did the TB, so 20, so when is the second step?
It should be on the 29th of May.
Of May. So you still have time for your May, June. Ooh, so you still have time. So you have you done the blood work yet?
I did, yes.
And you need boosters?
I will see that on Tuesday. So we'll
Okay,
confirm that with
so
you.
you're still ahead of the game because you did the thing there. So the booster you can, oh yeah, you still have time.
Okay, so it's fine if I get the vaccines after the TB testing, not the other way around.
Yes, yes, you still have time.
Okay.
Yeah.
Thank you so
You
much.
just want to give yourself enough time, but you're still good.
Thank you.
All right. Any other question?
I have, it looks like for my immunization, I have everything, but except for the influenza. So
you have everything up to date, Jeremiah?
yeah, I have everything up to date except for that. But
So the influenza is October, so.
Say that again?
The influenza is not until October.
Okay.
Did you take it last year?
The influenza shot?
Uh-huh.
No, I have to confirm. I'm looking at my record. It doesn't look like I have it at all.
Okay. So there's nothing we can do. If you didn't take it last year, then of course you have nothing to upload. So but you'll still be cleared without the influenza.
I'll still be cleared?
Mm-hmm.
Okay, because I thought it was like mandatory because I have everything just that. So I'm just like, I don't know if that would be.
It's not mandatory for the clearance, but we do recommend it because some hospitals won't take students without the flu vaccine. So we recommend that students get it, right? And right now in your situation, you didn't take it last year, so you just have to wait until October.
Okay.
But if you have everything and you submit your documents, Jeremiah, you should be fine.
Okay.
Okay. Vanessa.
Hi, just a quick question here. So if I have like not done TB before, I have to initially do the two-step?
Yes, you have to do the two-step.
Oh, okay, I understand.
Because you have never done it, yes.
Okay.
Now, if you go, Vanessa, and the first step is positive, greater than 10 mm, then the doctor is not going to do another one. You're positive. So
Okay.
the second one is going to be positive, right?
Yeah.
Questions?
Mm-hmm.
For the MMR and the hepatitis B, as long as I have the lab report showing evidence of immunity, I don't need to upload the proof of vaccines again, right?
Yes. We still need to see the evidence of everything, Karen.
Okay.
If you have it. I mean, if the blood work shows immunity, we know you had it, right? But they still want to see it.
Okay.
Can you find it?
I will go through the history.
Yeah.
I have a question.
Go ahead.
Okay, so sorry, I was just going through the medical requirements, and I see that saying here with we need to provide like a certification for Ministry of Labor, Work, Health, and Safety at Work.
That's the link I was talking about, Jeremiah. Is it Jeremiah? That's the link I was telling you to do.
Oh.
The certificate with the WMIS. Remember when I talked about that? Yeah. There's a link in here. I think it was what slide? Up here. Where I mentioned that you have to do that. So make sure you do that because you're saying you have everything, then you'd have to pay again to submit that.
Okay, let me see.
Where is it? This one. Yeah, this is what I said. If you're being BSN student, it's every 2 years you have to do this. Copy and paste the link and complete it. It's a module. You complete it, you get a certificate.
Okay, and if you don't, so if you don't mind me asking, is the link in the chat?
Yes. No, the link is in your handbook.
Oh, it's inside the handbook. Okay.
Yes, it's also in the handbook and the Ministry of Labor as well. That's in the handbook as well. So those are the two certificates.
Okay, so we just have to do that. Okay.
Yes. Yeah. And copy and paste the link into a new browser because if you click on the link that's in the handbook, it won't open. So you have to copy and paste it into a new browser.
Okay, no problem.
Yeah.
Thank you.
Okay. Took us longer than expected, but hopefully I was able to answer everyone's questions. And that's the reason why I don't care if we're here until 3 o'clock, but that's the reason why we're doing this, right? So, all right. Where was I? We talk about the TB. COVID-19. So of course, there are people not screening anymore. So at least 2 doses. That's what we recommended. At least 2 doses. I mean, if you have 3, that's a plus. Is it mandatory? A lot of places, again, you know, that's what they look at. Hospitals look at that. So if you haven't had the vaccine, I think I got an email from somebody that they're allergic to it. Then of course that's something to speak to the family doctor about, because we're not going to force you to take another vaccine if you're allergic to it. So follow up with the family doctor, so the family doctor can at least send a letter when to upload to Concise Health, right? So 2 or 3 doses acceptable. If you're thinking of getting it, go ahead and start the process, right? Because again, without the COVID vaccine, then you know some of the placement you would like to go maybe to a location near home. You might not be able to do that because, of course, that particular organization might want all students to have the COVID vaccine. So think about that, of course, because that will also affect, you know, placement for you.
I have a question.
Mhm.
Sorry, you go ahead.
I got my first dose of COVID vaccine this year in March, and the pharmacist told me that only 1 dose is required now.
Yes, I think I've heard that story. I think it was you, Karen, sent me an email about that. Somebody
Maybe.
else sent me an email
So
about that.
what should I do in this case? Do I
So I guess that it's because they're combined. So that's all we can accept, Karen. That's okay, right? If
Will
that's what's the guideline moving forward, you know, that's all you can do. That's
but
what you're
will
gonna upload.
will it affect the placement? Like if it shows
No,
1 dose?
right? No, because you gotta combine.
Okay.
And
Okay.
who told you that? Was it a family doctor?
The pharmacist who gave me
Okay.
the shot.
Okay. Okay. Yeah.
Sorry, excuse me.
I have a
If I
question.
if
Oh boy.
sorry, if I had a flu shot on November 4, 2024, would that still be valid?
For the COVID?
No, for flu. COVID, I have
The
my
flu.
3 COVID vaccine here.
So the flu shot you got last year, you upload that, but you need a
No.
new one this year.
Okay. I did that
But
November 4th, yeah.
you'll be clearing manual, but when you get the new
Yeah.
one, you're gonna make sure you upload it. Yes.
Okay, thank you.
I have a question.
Mm-hmm.
If you have a previous women's certificate and Ministry of Labor, is it still valid?
As long as it's within 2 years,
Oh, okay.
right? Yeah.
Thank you.
Expires every 2 years.
So I have a question about the COVID vaccine again. Just going back to what Karen said, she said that now we only need 1. I haven't gotten anything yet, but I do plan on getting the one. Would that if I don't get it on time, or if I get it just before, would that be okay?
If you don't get it on time?
Like if I get it just like next month, if I get it sometime next month, would that be okay? Okay.
Because your submission date is July, right?
Okay. I just wasn't sure, like if they say that we need 2 and I don't have enough like time to get the second one, like would that affect my placement?
But they're not giving 2 now, right? As per Karen.
Okay, but if the hospital like wants to, or if that's the
okay.
requirement,
But
that's my question.
yeah, that's your question. Is that Christine?
Yes.
So Christine, again, the guidelines now is saying 1, right?
Okay.
Because it's a combined, right? So based on the, you know, the changes in the guidelines, the hospital will also make those changes because you haven't had it previously, right? So now this is what you have, right? Will it affect your placement? Honestly, the specifics of the placement, it's more honestly the nursing homes, right? And you're in the BSN program, you're not going to go to nursing home. So you should be fine.
Okay. And if I don't want to get the vaccine, like how would that affect my placement?
That would be a little bit more challenging.
Okay. So if it would it just be that I won't get the hospitals
Yes,
I
you might
want?
not. Yes, because then Yanessa, who my colleague who does the placement, she'll have to find you somewhere. If they're specific, if that location is specifically saying the students need a COVID vaccine.
Okay, but would I still be placed in a placement?
You will, but it might be a little bit more difficult to find something.
Okay.
Right?
Okay.
So it's one is better with the combined one is better than nothing. Christine, basically that's what I'm saying.
Okay.
I have a question. You were just saying earlier to Christine that we're not going to place in the nursing home for BSN students. Might clarify a bit more about that, because I thought we start with a nursing home, then we go to a hospital. Like,
so you're not bridging, right? You're BSN straight.
Yeah, I'm actually the BSNF.
Okay, so I guess the BSN. I don't know if the BSN go to a nursing home, Jeremiah. I'm not sure. I know the bridging don't, right?
Yeah, but I believe the BSN we do.
They go to a nursing home. Okay. So sorry, I maybe misspoke there.
No, it's okay. I just wanted to clarify that.
Yeah, yeah. I would have to ask my colleague. Yeah, because really the bridge, when you're in the BSN, you're starting from scratch. So nursing home might, yeah.
Yeah, there's actually 3 streams. There's the BSN.
Yes. I know the bridging don't go to nursing home. Let me ask. Hold on. Let me find it. Let me get that.
Okay.
Let's see if my colleague will answer, because she's the coordinator. 5240759. Okay. So I was just speaking to my colleague. She's one of the coordinators. So she's saying for the BSN students, which I'm assuming most of you are here, they try not to put students in nursing home. Sometimes it's a challenge, but it's mostly rehab and hospitals. Okay. So that's what she was saying just now. So and this is where it becomes tricky, because if students are going to go into nursing homes, your VSS has to be within 6 months before clinical. So if you, for example, you live in Toronto, you see, that's it. That's the lack of clarity sometimes. If you live in Toronto and you apply for your VSS, May, June, July, August, September, October, November, you're still good. Your VSS within 6 months is still good. But it's not 100% that you go to nursing home, because they try to do rehab and hospital. Make sense?
Okay, so it's just it depends if they're not able to get you to
Exactly. If they're not able to get, because it's a lot of students, right? So if they're not able to get everybody in the hospital or rehab, then some students might have to go to nursing home.
So question, does that change over the semesters?
So first semester, of course, rehab. After that, it's hospital.
Oh, okay.
Yeah. After that, it's all hospital. Yeah.
Okay.
It's just the first one because you're going there for the first time, right? Yeah.
Problem. Okay.
Okay, so that's the COVID. Influenza, again, it's not mandatory, but we recommend it because you're taking care of vulnerable population, right? So we want to make sure that you're protecting yourself as well as the patients you're working with. So we recommend it. If you're allergic to it, it's a different story. There's a waiver if you're allergic to the vaccine. There's also a waiver, now that I remember, for the N95 mask for religious reasons. Some students shouldn't, because of religious reasons, they can't shave their beard, and the mask is going to be a problem there. So there's also a waiver for that one, and you'll have to reach out to Noreen. Okay. And she'll give the waiver. Okay. That was longer than I expected, but I think we got everything that we need to discuss. Let's see what else is here. Oh, okay. That was done. The step 3, make sure you have your ID badge. It's not the one card, it's the clinical card that you need. So please apply for your clinical identification card that you'll need for clinical. And use your preparedness. You have the form, you have the booklet now, the handbook. Use your preparedness to go through the steps. Make sure you're keeping track of timelines and deadlines because you want to make sure you have everything ready before July 29. Go ahead, Carola.
Regarding the photo for the Seneca placement card, are there certain specifications for the photo?
No. So if you have a copy of your photo from your one card, you can send that photo.
Okay. I just wanted to confirm because I think I've read somewhere that you need to have a white background, nothing around you or something. I think I've read that somewhere. That's why I just want to confirm.
Of course, you want to make sure it looks, because when you're taking it, it has to look professional, right? So, just making sure where you're taking it, it's a good location, stuff like that.
And it doesn't necessarily need to be the same as your one card. You can use a different picture.
Yes.
Okay, thank you.
One more question for the mass fit test. Is there a list of mass models that are accepted by the organizations?
So that's a good question, Karen. So once you get your mass fit test done, that's your mass fit test, right? You're going to upload that to Concise Health. Now, if you end up, for example, at a hospital like where I work, North York, they might not have your mask, right? So what they'll expect you to do, or what they'll tell you to do, is do the mask fit with them. You don't have to pay. You just do it with them so they can supply the mask that they have at the organization.
Okay, sounds
good. But that's not for you to worry about. You have your mask fit. That organization just doesn't have that type, and they'll, of course, make sure you're fitted to the mask they use.
Okay, understood. Thanks.
I have a question about what we have to wear for clinicals. Like, does it have to be like the Seneca logo with the scrub top?
Yes. Has to be.
So we can't wear any other scrubs?
No.
But the pants are okay if we can wear anything else.
No, blue pants, blue.
Okay.
What if it's a blue pants, but it's just not a Seneca blue pants?
Jeremiah.
No, just ask it because I know it's navy blue. It's supposed to be navy blue.
Yes. Okay. I know. Ask your clinical teacher once you get there, Jeremiah.
Okay. Miss, sorry, I did not hear that very well. So we're supposed to wear the Seneca scrub at placements?
Yes.
Oh, but our professor said that we don't have to, as long as it's navy blue.
Well, you're supposed at least make sure it has a Seneca. If your professor is telling you that, that's your professor, Cindy. But make sure it has this. You have the uniform with the Seneca logo.
Ah, really?
Yeah, it has to be. I used to teach clinical. I taught clinical for 10 years. Yeah, students have to have the Seneca logo uniform.
I thought we can buy the thing to stick on it.
I don't know if you can still buy it. I don't know. Years ago you could. I don't know if you can still buy it.
Sorry, for my Sims class that I had on Friday, she did say that for labs only, we can wear whatever scrubs we want as long as they're navy blue. But for placement, we have to wear the Seneca scrubs.
Yeah, it's a Seneca scrub. So I'm not sure what teacher is telling you that. Because when I was
think the confusion is for lab.
Yes.
Like lab, we don't have to wear the Seneca scrubs
yeah.
as long as it's navy blue. But if it's for placement, then we
You have to. Okay, so track again, your CPP to track. Ensure all requirements are completed on time, ladies and gentlemen. You don't want to get frustrated, right? So make sure you start the process early and get all your requirements done. And book your clearance with Concise Health. You want to make sure you have everything. Remember, the deadline to submit is July 29th. Try, if you have everything before the 29th, try to submit it, because I think last semester it was just chaotic. The last day, and the Concise Health didn't have the spots for students to upload their documents. It was just chaotic. So if you ever have everything before July 29th, don't wait until July 29th. Get it done early.
So if you get everything before July 1st, can you still submit?
Yes. Oh, yes, you can submit.
Okay.
Just make sure you have everything, so you don't have to do a return clearance. You're not missing anything, right? Because if you're missing something, yes, you have to pay again.
Yeah, but before you submit, you could share with
Make
Noreen.
sure
You could share with Noreen to confirm that everything is good to go
Share
before
with
you.
us, not Noreen,
with you.
and I. You send it to
Okay
you.
with you.
Yes.
Yeah, so that's fine. Yeah.
I didn't get that part. So before we submit to Concise, you can submit to who?
So before you submit the Concise, if you think you have everything but you're not sure, right, and you want to, of course, just review, then you can, of course, let us know, Yanessa and I, because we usually book in-person sessions at King, just to meet with students, and students come in person, we reviewed your documents, and we're like, yes, you're good to go. So we do that too, before the deadline.
Okay, thank you.
I'm sorry, I don't mean to sound repetitive, but just to make sure one more time, you said for the influenza vaccine, right? We have till October.
Yes.
Okay.
Yes, you have until October. You'll be cleared without the vaccine, because we know, of course, the October before the new before they start vaccination again. So yeah, we'll be fine.
Okay, and for that vaccine, like I think I read it, but I wasn't sure. We need to take it annually.
Yes, influenza is annually. Yes.
Okay. Okay.
Okay, ladies and gentlemen, how was that? Hope I was able to answer your questions. So you can email us at the clinical requirements. Why am I moving this? Inbox, right? I'll get back to you within 24 to 48 hours. We'll have, of course, in-person sessions again. We'll also do some other virtual ones if you need more clarification here. We try to support you as much as possible, but you have to also do the work, right? Go ahead, Yara.
I just have a question, or like regarding like what's the most important things that we have to start as soon as possible, so we don't be like.
So Yara, it's in your handbook. Get the 4 forms to Noreen by May 15th.
Yeah, like regarding the vaccine. So like maybe the VSS that like takes very long time. Like everything we have to start early, like that early, or like
so your VSS, if you live in Toronto, takes long. So start with that. Get your forms in, get the VSS ready if you're in Toronto. Email Noreen to get the information that you need for the VSS, and then start looking, of course, at your CPP permit. See take it to the doctor. I would suggest you do that as soon as possible because, again, as I said, doctors go on vacation. And if your doctor is gone for 3-4 weeks, it might be difficult to get an appointment with whoever is covering, right? You'd have to go to a family walk-in clinic. So you have to start the process based on all the requirements, right?
Thank you.
Don't wait last minute because you might need booster, right?
Yeah. So obviously everything I have to start.
Start. Yes.
Thank you.
If you have to do CPR and standard first aid, again, start looking at organizations that you need to get it done because, again, you get the temporary certificate and you have to upload the final certificate, which you have to do a return clearance to get that. So again, you know, it's a lot of processes involved, but as long as you started early, you should be fine.
Right. Thank you.
I have a question. So at what point of like and for like can we put our like where do you want to go to the placements? When do we do
After this
that?
is finished, after all this is finished, Christine, then of course, and you're cleared. So after the 31st, I think we're clearing on the 31st. After the 31st, maybe a week or two after, you'll get an email from your coordinator.
So if we get everything like all our things done and like ahead of time, would that
No,
no, we still have to wait for
No.
the 31st?
the
Okay.
31st. Yeah.
Thank you so much for everything.
You're
30
welcome. Because we go through the clearance and look at everybody. Because we do say the 29th. So we have to wait until everybody submit, right? And then on the 31st, Yanis and I go through the clearance. And then we're like, okay, these students are cleared. We send it to the coordinator. And then once the coordinator get all the names of the students who are cleared, the coordinator will send you an email for you to do your choices.
Okay,
Sorry,
perfect. Thank you so much.
is it
You're welcome.
July 31st or
No, don't get July 31st is Yanis and I will clear. We'll do the clearance. You have to submit your documents by July 29,
yes, okay.
right? So don't get those two dates mixed up. That's why I didn't want her to put it on the slides because I'm like, they're going to see the 31st and think they have until the 31st, right? Okay, so here, right? July 29th is the last day for you to submit. And I would suggest you, if you have everything ready, don't wait until the 29th because Concise Health, they'll deal with other schools. And it's a lot of students, and sometimes they don't have spots for Seneca students, right? Which no fault of your own. We say July 29th, but Concise Health doesn't have the manpower to accommodate so many students on that last day. Make sense? So if you have everything and can submit it before the 29th, I would suggest you do that.
Okay. One more question about the vaccine. Like I said, I have the vaccine record back in my home country. Let's say I don't have them translated, but I do have the blood work, the updated blood work showing immunity. Is that okay?
So we, again, Concise says want to see the evidence that you have had it, Karen. Send me an email. Let me just confirm this with Yanessa, which is my colleague. Just send me that email and I'll get back to you on that one to see if you have the blood work that shows it, if you still have to provide the evidence.
Okay, thank you.
Okay, yeah. Okay, that's the end. Any other questions?
No, thank you so much for your time.
Thank you so
Thank you.
much for your time.
You're welcome.
Thank you for your
And your
patience.
patience. Yeah.
And remember, the clinical requirement inbox is there. Email us if you have any questions.
Thank you, Miss, for being so patient.
You're welcome.
Thank you.
Okay. Have a good rest of the day.
Thank
Have a
you.
good
Bye.
one.
Okay.
Thank you.
You didn't mind our funny questions, right?